increasing omega-3s and reducing omega-6s seems to be beneficial for reducing pain. And indeed, in this study, they find something quite similar. What I'd like to discuss next, I find extremely exciting. Why? Well, what I'm about to describe is a compound, or I should say a set of compounds that are available over the counter that have been shown to be very effective in reducing the frequency and intensity of headaches. And not just one kind of headache, but multiple types of headaches. So what I'll describe has been shown to have significant effects in reducing the intensity or frequency of tension-type headaches, migraine-type headaches, as well as hormone-type headaches that are related to the menstrual cycles that I described earlier. What I haven't told you yet, of course, is what is the compound that I'm referring to? What is this over-the-counter compound? Well, it turns out this over-the-counter compound is not just available over the counter, it's also available in food. So it turns out that nutrition can have a very strong impact on the frequency and intensity of headache, although supplementation with this particular compound can accomplish the same thing as well. What I'm referring to here are omega-3 fatty acids. Many of you are probably familiar with omega-3 fatty acids. These are fatty acids that come in the form of so-called EPA and DHA, and omega-3 fatty acids are commonly distinguished from the so-called omega-6 fatty acids. Omega-6 fatty acids come in a bunch of different foods, and they, of course, can be supplemented as well. Omega-3 fatty acids come in a bunch of different foods and can be supplemented as well. Common sources of omega-3 fatty acids in foods include fatty ocean fish, including salmon, salmon skins, sardines, anchovies, things of that sort. Common sources in supplement form are so-called fish oil capsules or liquid fish oil. Again, omega-3 fatty acids. And almost always when we're talking about omega-3 fatty acids, we're talking about a combination of EPA and DHA. But really, it is the quantity of EPA omega-3 fatty acids that seems to be the most impactful for the sorts of health metrics that we're going to talk about in a few minutes. Now, with respect to omega-6 fatty acids, the most typical food sources of omega-6 fatty acids are seed oils. The particular omega-6 fatty acid that's going to be relevant for today's discussion is linoleic acid, and that is common in a lot of seed oils. So again, I'm not going to tell you that seed oils are bad. However, it does seem to be the case that many people are consuming far too many seed oils, and in doing so are consuming far too many calories, and perhaps are consuming too much of the omega-6 fatty acids relative to the omega-3 fatty acids. Now, with that said, I think there is general agreement among nutritionists and health professionals that we could all stand to get more omega-3 fatty acids, perhaps for cardiovascular health, although that's a little bit debated, but certainly for immune system function, for mood, and for functioning of the brain, and for the potent anti-inflammatory effects of omega-3s. But in thinking about headache and different treatments for headache, there are some recent studies exploring how supplementing with omega-3 fatty acids, and in one case, how supplementing with omega-3 fatty acids and deliberately reducing the amount of linoleic acid, the omega-6 fatty acids, how that can impact headache. So the first study I'd like to describe in reference to the role of omega-3 fatty acids in headache was published in 2018, and the title of the paper is Long-Chain Omega-3 Fatty Acids and Headache in the U.S. Population. They refer in this study to an earlier study that looked at the so-called analgesic effect, the pain-relieving effect. Analgesic means pain-relieving effect of omega-3 fatty acids in what had been a randomized control trial. And in that previous paper, what they found was that diets high in omega-3s and low in omega-6s, okay, so high 3, low 6, and as compared to diets that were just reduced omega-6s, they found a greater analgesic effect of increasing omega-3s while also reducing omega-6 fatty acids. Again, in all of these studies, because these are the ones in which they controlled things well, as we say, they are holding constant the caloric intake. So it's not just that you're removing fat, eating less fat. There's actually a removal of certain fats and fatty acids and a replacement of those with omega-3 fatty acids in one case. In the other case, it's just a reduction in omega-6s, and you're using other food types and macronutrients to offset that reduction in calories caused by reducing omega-6s. The basic takeaway that they're relying on marching into the study is that increasing omega-3s and reducing omega-6s seems to be beneficial for reducing pain. And indeed, in this study, they find something quite similar, which is that when you hold caloric intake constant and when you look at omega-6s, whether or not you decrease omega-6 fatty acids or not, you find is that increasing omega-3 fatty acids in the diet, so either consumed through food sources or by supplementation, was associated with a lower prevalence of severe headache or migraine. So severe tension type headache or migraine. So this is promising and points to the fact that long-chain omega-3 fatty acids are likely to have either a pain reducing, and there's evidence for that, and or an inflammation reducing effect that can significantly reduce the severity of headache in both tension type headache and in migraine. So the basic takeaway is that if you are interested in reducing headache, it may be beneficial to increase amounts of omega-3 fatty acids, and it does seem that getting above 1 gram per day of EPA omega-3 fatty acids, either through food or supplements or both, is going to be the critical threshold for reductions in the frequency and intensity of headaches that include both tension headaches and migraine headaches. As far as the data sets we talked about here are concerned, it is clear omega-3 fatty acids are going to be a very potent way to reduce pain and to reduce inflammation in ways that can reduce the frequency and the intensity of different kinds of headache.